Everybody. Um, I'm gonna, we're gonna try to do some initial discussion about revenue stuff today. And we're gonna go through the slide packet that you were all sent ahead of time. And then, and do some discussion about them. And then have our usual, right before we end, questions that we want to ask the Consumer Advisory Committee. And then also, I don't know if anybody signed up for public comment, so I'll leave it to staff to figure out whether we have to leave time for that and speak up.
I believe I did get notice that one person did indicate that they would be offering.
Yeah. Let's assume that it's going to happen, that there'll be people. So, so I will turn it over to Laurel and Sarah.
Great. So, as Chuck said, today we're going to be discussing revenue methods, and additionally, we're going to endeavor to develop 3 to 4 revenue packages that we that you all would like to see analyzed at our upcoming meeting, at our following meeting 6. I have this timeline up so that we are all grounded in kind of the work plan and deliverables that we are, and the goalposts that we're working towards. So at the March meeting, the FNR tag is slated to be presenting a proposal coming out of this tag. And so our goal for today is, in order to get prepared for that March task force meeting, is to develop 3 to 4 revenue packages that you all would like to see staff analyze. And then that will tee us up to develop those analyses in coordination and collaboration with the Legislative Revenue Office, and then pivot to actually presenting those 3 to 4 analyses at meeting 6 on our March 17th meeting. And then our goal at our March 17th meeting will be to hone in on what it is that you all would like to be presenting to the task force at that March task force meeting. So we wanted to be really clear that our goal today, we really need to be leaving today with some packages for analysis. So,
okay.
Any thoughts or anything? Okay. So our last time around, we took a stab at developing some principles, and we went back and augmented this slide a bit. We offered some augmented definitions to some of these to better reflect the discussion that we heard last time around. And then we added 3 kind of items. We added this component around adequacy, this component around the revenue being a dedicated trust fund, and then this component around maximizing federal dollars. I want to reiterate that this list is will be evolving and changing, and so as principles pop up in your discussion, I really would encourage you to try to call those out, because the more specific that we can be in the principles that are guiding your decisions around revenue, I think the more successful we can be when we actually come to the decision-making process. So last time around, we mapped out the various components that cumulatively add up to the total cost of the system that we will be analyzing. And it was a bit of an overwhelming exercise, and we're really grateful to all of you for kind of sitting through it with us. And at the end of it all, on the other side, we really felt like the best approach to be informing discussions about revenue would be to actually turn to the total expenditures of the current system. The RAND report that came out in 2017 illustrated that the total cost of a single payer system would likely be on par with the total cost of the status quo. And the RAND report is not the first report to offer that type of estimate. Generally speaking, there are several studies out there that indicate that total cost of the status quo is likely on par with the total cost of a single payer system, given a handful of parameters. And I'm going to, in a second, talk through some of those parameters. Looking at our current system and using the RAND report as a jumping off point, they essentially estimated that under a single payer system, they estimated that in 2020, the system would cost $36.2 billion. There have been other estimates that with respect to total expenditures of the current system that might indicate that 36.2 billion is on the low end. We offered, when we presented total expenditures at our second meeting, we offered a number closer to 40 billion. But I think generally speaking, 40 billion-ish is likely a kind of ballpark number that we can be working with when it comes to the total cost of this system. However, when we're thinking about the amount of dollars that need to be raised by a new revenue stream, we can't forget the payments that already exists with respect to federal outlays. And so the RAND report kind of goes through and offers line by line the various funding streams that are funding the status quo and how they may slightly be augmented to fund a single payer system. And at the end of the day, they put a price tag to the current federal sources at 22.2 billion, which leaves around 14 billion for the as a price tag on what the new revenue stream needs to be generating. We again want to be pivoting to a discussion of revenue methods and get to a place where we can be discussing revenue packages. So we don't have a lot of time to be digging into this cost, again, these questions around costs, but we wanted to offer kind of our thinking on why 14 billion might be a good target to be keeping in mind when thinking about the scope of revenue that you want to be generating through these new streams.
Laurel?
Yeah.
This includes the current spending in the state on Medicaid, correct? That's inside the 14 billion. So whatever Oregon is currently spending is included inside that 14 billion, correct?
That's right.
Okay, thank you.
Yeah. Thank you for that clarity, because I realized I was saying federal outlays.
Could I also ask?
Yeah.
When it comes to Medicare, what are they considering to be Medicare taxes versus payments that Medicare patients make? In other words, for Part B, I'm paying a premium every month. And then I'm paying, for Part A, I'm paying a lot of cost sharing, no premiums. But I mean, in Medicare, there's a substantial amount of payment by individuals into Medicare. And I'm worried that some of this may be coming across as a tax, which you could argue in some cases it is, but the individual is paying for it. You follow me?
Yeah, I am. I want to ask because I don't know the answer outright at this juncture. We do have Nora from Health Management Associates who I believe is on the call. Nora, if I may put you on the spot here, do you have any insights into this since you did work on that RAND report?
You're muted.
Sorry, I was double muted. The consumer outlays both for Medicare as well as for commercial coverage, the part that's paid by the member, is not included in the 22 billion. It's included in the 14 that needs to be replaced. And that's the case for you know, all consumer
Cost
outlays.
sharing.
So
yeah,
cost sharing. So this doesn't assume member cost sharing, just because, to give you a ballpark figure, we thought we would just set it like, what's the amount if there's no premiums and cost sharing for anyone.
Thank you, Nora. John, does that start to address your question a little bit? Again, acknowledging that unfortunately we don't have the time to really dig into a robust cost conversation.
So, yeah, I think so. And then just, I'm assuming that is for the Medicare benefit. So that's not for dental for Medicare folks, for additional mental health, vision. All of these estimates from RAND are based on the benefit packages in each of the specific revenue streams, i.e. Medicare, Medicaid, and commercial, not, you know, truing them all up to a similar benefit package.
Correct. It's the current spending, and I think there's a slide that's coming up that has that shows you kind of the dollar amount shifting. Okay. So it's existing revenue or existing funding sources and what the new revenue would be.
Okay.
Nora, thank you.
So does it? So I'm still a little confused. So does it include the spending by supplemental plans or spending by Medicare Advantage plans?
This is Chad. If I can guess, I would guess that it's the total CMS outlay, and it doesn't correlate at all with any contributions that the individual Medicare members might contribute into the feds.
Right, or the insurance that they buy.
And certainly, I would think it does not include any supplemental insurance, since that's not a CMS issue.
Right.
And again, just, excuse me, taking a step back here, our goal here is to get some semblance of a ballpark. And so even putting the RAND study and the RAND methodologies aside, looking at the total expenditures number for the current system and the current status quo, we have, there are several different ways that we've tried to kind of make that estimate. And again, 36 to 40 billion as a total really does kind of, there's consistency that that's a solid range to be thinking about. And these Medicaid numbers, excuse me, these federal numbers and the Medicaid funding adding up to 22 billion is what gets us to that 14 billion. I understand though the relevancy of the questions that you guys are asking, and we can go back and listen to this conversation and see if there's any way that we can offer additional clarity and follow-up slides that get at estimating cost. So while we're here, because hopefully, as Nora said, hopefully some of these slides will kind of offer some of that clarity that we're looking for. So these are graphs that are coming out of the RAND report. We kind of augmented them so that we're really only comparing the single payer system to the status quo. And you can see the way that the dollars kind of will be shifted based on the funding proposal in the single payer system as presented by RAND. So we have on the left this single payer option, on the right this status quo option. The status quo option includes premiums and out-of-pocket payments by households and with respect to employer-sponsored insurance. And you can see that under the single payer system, there's a real shift here wherein the state outlays for universal coverage are taking up the majority of the cost here, and there's a very small slice for out-of-pocket payments, premiums and out-of-pocket payments, which I'll get to in a second to outline what the parameters were that Rand proposed in the system that they were proposing. I want this next slide. I'm just going to pivot straight away to this next slide because I think questions about either of them are fairly relevant, and seeing both is helpful. So what this slide attempts to do is look at the source of the revenue. And so you can see here that for the status quo, again, you have these payments by employers and employer-sponsored insurance, other premium and out-of-pocket payments, and the state personal income tax is accounting for a relatively small portion of the status quo. In the proposal that came out of the Rand report, that proposal was funded by a payroll tax and an income tax. And so you see the dollars that employers were putting into the system vis-a-vis premium payments shifted into this employer payroll tax number in the single payer system. Again, this is specifically related to the system that was presented by the Rand report and the parameters that they outlined for the single payer system. So I'll pause here and ask if there's any additional questions or clarifications that are needed after seeing these two slides. Okay.
I'm sorry, Laurel.
Yeah.
Nora, I have a question about the anticipated out-of-pocket payments, that very sliver at the top of a single payer.
Yeah.
Is that anticipated to be co-pays for drugs or?
Yes, and that's actually a great segue for this next.
Thank you. I'll back off.
Yeah. No, so it's in this concept of what the parameters are. I think this slide here really dives into where the various numbers are coming from. Instead of going line by line, in this presentation, we wanted to make sure to include this chart and to be highlighting kind of the new revenue sources that are included in the Rand report. And we wanted to include this chart in the slide deck so that you all could be referring to it during this conversation. I'm not going to go line by line here. Again, a great transition coming from Dr. Metz. It was really important when we were kind of looking at this to be highlighting the parameters that the Rand report set out in this proposal. The first one being that they are proposing a single payer system that incorporates a scope of benefits that is the EHBs, the Essential Health Benefit Benchmark Plan. And this benchmark plan is slightly less robust than, for example, the PEB or OEB plan. I'm noting this simply because at the upcoming task force meeting, we're going to be discussing the benefits package that the task force wants to be considering. And it's just important to note that this EHB plan is notably less robust than the PEB plan, and I think less robust than the proposal that we're going to be seeing coming out of the EBA tag. Similarly, another important distinction is the Rand report did not incorporate long-term care. They left institutional long-term care to continued to be financed through a joint state federal Medicaid program, not incorporated into this system. Additionally, they included cost sharing. They included cost sharing for folks with incomes above 250 federal poverty level. And essentially that amounted to co-payments on average that equal roughly 4% of total spending on covered benefits. Two more important parameters that they included. The first is they set provider rates at 10% below the average rates in the status quo, which is a very notable parameter that they set for their analysis. And then lastly, they included these passbacks. So for the first, these wage passbacks, for the first 5 years of implementation of this single payer system that they're proposing, they proposed that any employer that previously offered health insurance to its workers would be required to pass back any savings on health benefits that they are accruing as a result of no longer paying for those premiums and instead paying for these payroll taxes. So the difference between the amount they were paying on employer sponsored insurance and the amount that they are paying on these payroll taxes is to be passed back to their employees in a manner that was supposed to be kind of mitigating any type of windfall that employers could otherwise experience from the transition to this new system.
So I'm a little confused about how that last thing would work, and also sort of how it affected the sort of estimates in the RAND program as far as cost to people.
Did I just see someone else want to?
Well, you know, I'm with you, Chuck. I mean, I think that it looks like employers are absolved of their financial responsibilities to be picked up by the state here. So I heard what you said, Laurel, but I'm not sure how it works.
Yeah, and you know, with like the folks I've worked with on calculating what a payroll tax impacts would be, they just always assume it's the payroll tax is passed along to the worker, to people. It's that there's probably debate about that ultimately about, but you know, I know, but when I was an employer and I looked at the cost, both health insurance and payroll taxes and whatnot, that's, you know, when I was figuring out the salary for someone and how much money I had to spend. So but it seems like an impossible thing to calculate, and
Yeah.
open to widespread gaming. So
I think that's a really helpful flag for us, that we can try to come back with more clarity on the RAND proposal as it relates to this. I want to make sure that we're able to pivot to these revenue methods. So I'll definitely make a note and probably attempt to follow up over email in advance of our next meeting to kind of offer some clarity on what RAND was thinking on this. Okay. So then again, since we're using the status quo kind of as a jumping off point for estimating cost, I think it's also important to be using the status quo as a jumping off point for discussing revenue. In that vein, we wanted to include 2 slides that Chris showed that attempt to summarize the current general fund and where money is coming from in the general fund. Looking at this slide, I mean, I think it's one of the biggest takeaways here is really the role that the personal income tax is currently paying in funding our general fund. Additionally, that's in that 1 billion other revenue. The next slide tries to, or let's see. Well, both of the others is attempted to, this slide attempts to outline what is comprised, what that other fund is comprised of. Again, I'm not going to go through each of these, but we wanted to include this slide, especially for when we get to the portion of the conversation where we are kind of brainstorming possible revenue packages. We thought it might be helpful for you all to be able to have a visual representation of what the current revenue streams look like. Okay, I'm going to turn it over now to Nipper.
Great, thanks, Laurel. So I am going to be spending some time here walking us through sort of these 5 big buckets of revenue methods. And the purpose here is to just give us a common understanding. What is it? What is the sort of scope of revenue that such a method might, bring in? And then how does it align with the values that the tag identified? And we sort of pulled that in along with strengths and challenges for each of these. So I'm going to go ahead and start walking through each of these, starting with the personal income tax. So personal income tax, tax on salary and income. The table here shows the current tax rates that we have in Oregon. Of course, because Oregon has no sales tax, our revenue system is much more heavily dependent on income tax. And so our income tax is higher relative to other states. Any income tax that, suggestion or recommendation that would be developed for the single payer plan could look different. It could build on these tiers. In the RAND report, they did estimate $7.5 billion in income taxes, and that was they got there by raising these top 3 tax rates. So instead of the tax rate being between about 7 and 10%, the top tax rates would be between 13 and 18%, and that's where they came up with the $7.5 billion. Great. So income tax strengths and challenges. It can be it is a more progressive form of revenue. That's one of the values of the tag, and that the more money, the more income you bring in, the higher rate tax you pay. And while certainly the calculation itself is complex, the concept of the income tax is pretty easy to understand. It is a fairly stable income stream, although a little less recession-proof than a sales tax. It's scalable, or it can be scalable. It's permanent. There's no issue with ERISA that we would run into by relying on the income tax, and it can be dedicated to healthcare. On the other side, the challenges, it is really not adequate to be the sole funding source for any plan without making it incredibly high. Income tax, of course, there's no federal match. It doesn't increase our federal dollars. It can be complicated, and there are administrative costs involved to ensure that such a system is developed and is that there's compliance with it. There certainly is a belief that increasing taxes may discourage high earners or additional income being brought in. And then lastly, as I said, we already have a high income tax. And so that may be a challenge to raise something that is already considered among one of the highest in the nation.
And I just want to say, what right now people are paying for healthcare through the income tax, right? It's our biggest source of revenue, and that's the biggest source of money for the state match for Medicaid. And so one of the options for trying to get money into a trust fund or whatever to fund universal care is to say, have someone at Legislative Revenue and Fiscal calculate sort of what, and we could put it into the statutes, X percent at each of income that's taxed at each tax rate would, and it could be different for the different tax rates, would be just diverted into this fund versus where now it's subject to a biennial appropriation. So, the legislature today could say, well, of the people of the 4.5%, 4.75% bracket, 0.75, the 7.75 all goes to healthcare, and the 4% goes to the rest of the general fund. And so you can divert it that way as well, not only just for what we're currently spending. We did have a higher rate for a couple years when we passed measures 66 and 67. It was an 11%. So there is room to do stuff either at a higher rate or take away some of the tax breaks that the wealthiest get. But you're absolutely right that we can't raise the big bulk of it through the income tax. And Rand's calculation, in my view, is very simplistic, but it showed the problem.
And I again think it really lets employers off the hook. And I think they get a big bonus here. And I would want to be comfortable if that's not occurring.
Yeah, I mean, now employers, when they pay for insurance, that's considered a normal business expense that they get to deduct. Right. And for and it's not taxed as an income to the employee.
Correct.
Right? And that's a huge tax expenditure. And so, so if you took away the, the premiums, if you could force that on them and put in a tax for the employer side, it would be identical. It would be identical, whether they're, and also, whether they're, and that's why I was troubled by that last bullet point on the RAND thing, because, currently, if an employer is paying for healthcare, they're probably paying their workers less too, right? We all know that. And so the idea that the payroll tax could be calculated to how much is passed on. So I don't really see that as the problem. I think you can, I don't really see that as the problem, but you can also, anyway, let's go on.
Thanks, Chuck. So the next tax we're going to talk about is the payroll tax, which we've already talked about a little bit. So, this is a tax imposed on employers and or employees, percentage of the salaries deducted from individuals' wages, and on the employer side, it's paid based on the employee's wages. Currently, there are federal payroll taxes in place for Social Security and Medicare, both of which are split 50-50 by the employer and the employee. There is a cap. I believe Social Security goes up to 142,000 or something around those lines. And then there's a little bit of a higher tax on Medicare, payroll tax on Medicare for folks making above 200,000. There is, oh, no, go back.
Sorry.
Thanks. There is the flexibility for states to implement a payroll tax with different rules. There could be an employer only tax. There could be a payroll tax that excludes small employers. There could be a payroll tax that excludes employers that have below a certain revenue level, or revenue that's above a certain amount. In the RAND report, the estimate given was $5.6 billion in payroll taxes for universal health care. This was based on a 6.5% payroll tax on employers that had at least 20 workers in their firm. So this actually only applied to 10% of firms. So 90% of firms would have been exempt from this. But with the 6.5% tax, the firms would pay roughly the same amount in payroll taxes that they would have with the premiums they're paying for healthcare on behalf of their employees. And this is where the 5-year kind of wage passback piece, but we've got a pin in that to revisit later. So, okay, you can go on to the next one, Laurel. Strengths and challenges of the payroll tax. So the big strength is that this is a very, can be a very effective way to raise revenue. And while, you know, federal payroll taxes are regressive, a state payroll tax can be made less regressive, more progressive, depending on how it's designed. And there is more flexibility about, like I said, requiring that employers invest certain, amount of savings or whatever they're saving, and that goes back to their employees. There's a lower likelihood that quality or quantity of labor will be affected. So in the sense, what I was saying before with the income tax, where higher income taxes may be discouraging, additional income, higher income. That's not the case with the payroll tax. This is a fairly easy to understand revenue method. It's really hard to get out of paying. And it can be, dedicated to healthcare. It's fairly stable and predictable. The big challenge with the payroll tax is that in order to make it large enough to be the sole or heavily primary funding source for a single payer, this is where potentially we really run into an ERISA challenge, because the tax is disproportionate versus, compared to what the premiums that employers would have been paying for healthcare. So ERISA challenge is very likely here, depending on the size of the payroll tax.
And I just want to say, just remember that, our unemployment insurance tax is a payroll tax. There's some transit taxes in Oregon,
Right.
in the metro area primarily. It's in the development stage, which was passed by a prior legislature, is the family leave tax,
Family leave, right.
which is, so you can do it, and then, again, that last bullet on the left side, I'm not so sure you can compel that very well, that it's without lots of gaming and whatnot. So, but you can do that. You can split it, and you can also start it at higher incomes. Now, don't go of the employees, or change it at different incomes of the employees.
Sarah,
I
I
have
have
a
a
question.
question about the exposure to the ERISA challenge. Is there a threshold beyond which it becomes more likely to be challenged? That is, if you bifurcate it between several sources, income tax and payroll tax, is there a point which you're safer from an ERISA challenge? Do we know that?
Chad, I can help answer that. No payroll tax is safe from an ERISA challenge. We are in totally unexplored territory. There is no legal basis to think that we won't be challenged no matter what we do.
Weren't there some other?
I would
other
add,
schools-
though, I would add that the RAND report, when they were doing their calculations, they endeavored to create a payroll tax that would be roughly on par with the amount of money that employers were paying on employer-sponsored insurance. And so the attempt was to start there, in order to, make the argument that there's not a greater financial burden on employers. So they attempted to bake in a defense, knowing, as Dr. Met said, that it's very possible that ERISA challenges may come regardless of what revenue stream is used.
Chad,
Yeah, and-
also think about this as a percent. Currently, 10-year-old data in Oregon says that a company that purchases health insurance for its employees pays about 12% of payroll for those premiums, and another 1 or 2% for HR personnel to take care of it. If we have a payroll tax of 12%, then the half of the businesses that will see their healthcare costs go down will not sue us. The half that see their costs go up will. If we make the tax low enough, we can reduce the odds lower, but not quantifiably. And the higher that payroll tax, the higher we will pay. And I do have another unrelated question when we're done with this issue.
Thanks, Sam.
Yeah, I just want to say to Chad's comment, the women, when we had that presentation on ERISA, said having diversity helps of taxes coming in. And I think some of the issue is if an employer isn't providing health care and now gets the tax, I'm not so sure they could get an ERISA challenge, because they're not providing health benefits, right? It's not an offset to that. So I'm not convinced that anyone would automatically lose. I mean, they may sue on anything we do, right? But I'm not so sure that makes it so vulnerable, and that there's not a way to make it less so. So that's sort of one of the areas I think we need more legal advice on how to do it.
Yeah.
And also hear from the business community.
I have a question.
Sure, go ahead, Glendora.
Can someone explain to me how the flat tax rate compares with the progressive rate? And did the RAND consider the pros and cons of a flat tax rate?
So my understanding is RAND just looked at a flat tax rate for payroll tax. And so a flat tax rate is not progressive because it's not based on ability to pay. But you can have, and in fact, our federal taxes are even more regressive because it cuts off the tax at around 140,000 a year, so that the overall tax rate is a lot lower for a very wealthy person. But we can do the opposite. We could say that you would not be taxed on payroll until you got to that cap, the FICA cap, and any payroll or other earnings. You can do it on other income too. Over that level would be taxed under this tax that is based on payroll, but isn't maybe even a payroll tax because you're looking at other income, which is a way to really expand.
So do we know how? Do we know how it's faring in other states that use flat tax rate, such as Illinois and Colorado?
Well, one thing that one kind of nuance that I want to offer is that this payroll tax only applied to, Nipper, was it 10% of firms? And
10% of employers.
10% of employers, excuse me. And so,
Yep.
so by definition, a flat tax applies across the board to everyone. And this tax only applied to a very small slice of employers. So I might respond by saying that it's not necessarily a flat tax. Chuck, I realize I don't want to be going head to head with you on this stuff because I know that you know it better. So perhaps characterizing it as flat is still accurate, even if it only applies to 10%. But I did want to offer that nuance.
And we're not bound by what RAND used,
Totally.
right?
Totally.
Right. So we should say, if we want to use a payroll tax, let's design one the way we think it should be designed, both based on progressivity and whatnot considerations, as well as ERISA considerations.
Yeah. I know that Dr. Metz had a question, and then I'm also seeing a hand from John.
Thank you, Laurel. Nipper, you described the income tax as fairly stable, and you describe the payroll tax as relatively stable. Are these the same terms?
They are the same terms. Yeah.
Thank you.
John?
Yeah, I'm interested in the Medicare payroll tax. I mean, realize we are talking about a plan that likely will create much better benefits for Medicare. Much better benefits for Medicare. And to what degree would it be reasonable to have an Oregon Medicare tax? That employers, as you can see, would contribute to. They're not contributing to their employees, they're contributing to Medicare. So this doesn't involve health care for their employees, it involves Medicare. And we would, because, I mean, one of my concerns here is I believe a substantial portion of the money we're having to raise will go to Medicare patients. So, you know, I don't want an answer, but if you could put a pin in that Medicare payroll tax.
John, I want to make sure I'm understanding kind of the direction that you're going here. Are you suggesting that a payroll tax, what you're suggesting is not just a branding issue, right? You're talking about a tax that would replace the payroll tax on Medicare now, or?
No, the current payroll tax all goes to Part A. I think this is how Part A is funded. What I'm saying is in Oregon, we would say, we want to do a lot more for Medicare folks than the federal government does. And so in Oregon, we want to have the, what is it, 0.25? What's the, go back to the last slide. So it's 2.9% of income. So we want that 2.9, but we want another 2.9. And that will be used to fund the additional benefits that Medicare patients are going to be provided.
So you're suggesting having,
A supplement.
assuming this is all one plan here with a single benefits package that would, you know, be covering Medicare requirements, Medicaid requirements, et cetera. Are you saying that you would like to see potentially a tax that is solely for the Medicare portion of that?
Yes.
John, I don't think, I mean, I think you could put a payroll tax on residents, but I think that you're going to have a hard time persuading Medicare that there's going to be additional dollars expended beyond which Medicare approves, kind of, because they're very stringent on, even with the Medicaid waivers, that it be a wash to the feds. And
it would be a wash to the feds. I mean, these would be dollars. These would be dollars that would pay for Part B. These would be dollars that would pay for dental.
I guess good, but I don't think you'd want to label it as Medicare, I guess.
Well, I'm intrigued that employers are contributing. So this is a way to get employers to pay for Medicare, not for their own workers. You know, I want to have a discussion at some point, Chad. I'd like to get employers out of this for the most part. I'm influenced by the CAC discussion we had about decoupling healthcare from employers was, you know, a slam dunk for them. Employers don't belong having any influence on our healthcare. Let's get rid of.
I think there's a difference between contribution and influence, but beyond that, it seems like you could do a transitional plan which would wean the employers off contributions over a period of time. But if you totally absolve the employers from their contributions, the tax hit on the citizenry huge.
I know, but one thing I'm saying is you could argue they should continue to contribute to Medicare. That's a social good that they should contribute to. And anyway,
it sounds to me like you are sort of talking about almost a branding thing. So for instance, we could say, we think a 5.8% additional tax on payroll would bring in enough money for our big plan. But when we actually rolled it out, we would say, what does that mean? Well, we're going to do a 2.9% state Medicare tax, and we're going to have a 2.9% state universal health care tax, right? And so that's what I think you're saying, John, that some of it you could say, we know in universal care, a big chunk of it's going to go to Medicare people, right? And so we could sort of sell it that way, that this isn't this is like you're giving to the common good of Medicare, not to your employees. It also sort of seems like that would take it out of ERISA too. Right?
I'm trying to get it out of ERISA by actually saying,
calling it a Medicare tax.
That's right.
It's the state, and so even if we calculate at the end that all the stuff universal care is picking up are really to the Medicare population, and that would equal 5% more of a tax on payroll, we'll just call it a state Medicare tax.
Yes.
I don't think that's going to fool ERISA lawyers, to tell you the truth, but.
I'd like to, at this point, just remind folks this meeting is being recorded.
Okay, so we are going to put a pin in that. I understand what you're suggesting now, John. I'm going to move us on just so we can get through the rest of the revenue items here. Yeah, okay, so I mean, we have talked about this a little bit, but when we think of what the impact of such a payroll tax might be it on both the employees and the employers, it's really going to vary. So at the individual and family level, so if their employer is no longer covering paying premiums, then the individuals are no longer paying premiums for the health plan. Or excuse me, if they're covered by an individual plan, they're no longer paying premiums for a health plan. If they're covered by a group plan, their employer that's no longer happening through their employer, so they're no longer paying premiums for the health plan. Obviously, this kind of spans payroll tax and income tax too, but I think the concepts are most relevant to the payroll taxes that we were just talking about, particularly on the employer side. So, if they were paying if the employers were paying premiums for their employees, they're not paying those anymore. And now they've got this payroll tax potentially in play. And so we've got this calculation, about the amount of the payroll tax, the amount of the premiums, depending on whatever the threshold is. If this is the direction the tag wants to go, there's a lot of flexibility about what that threshold for an employer payroll tax might be. And something Chuck brought up earlier, which is actually not reflected in these slides, I think, is the possibility of the employers passing that tax on to the employees, which I think is something that we also need to just be really clear about, that certainly is a possibility. Okay. So let's talk about sales and consumption taxes. So in the RAND report, they proposed, or they modeled, the impact of an 8.4% sales tax. This would exclude groceries, utilities, kind of that essential category of services. And such a tax would, they estimate, result in 8.5 billion new revenue, which is about 60% of the way towards that 14 billion that was required. So that's the sales tax piece. The other thing is just there's a lot of consumption taxes that already exist and that they have dedicated revenue allocation. They're much smaller in nature, but I'm going to walk through the different pieces here.
One thing just to add is that this RAND, oh, Chuck, you're on mute. One thing I just want to add is that the RAND report estimates here are for a different proposal. So they did not propose a sales tax as part of the single payer proposal. They proposed a sales tax for another model entirely. But they offered some estimates that I think are that we thought were worth noting in discussing a sales tax.
And are these all annual or biennial numbers? I'm sort of. They're biennial,
these are annual.
right?
Annual.
They're annual. Okay.
Yeah.
Okay.
Yeah. These are annual, but the pie charts that you saw, this is an important distinction that we did talk about, are biennial. And so, correct, Nipper, you're looking.
Yeah. No, that's right.
Yeah, okay.
The ones that came from Chris's office.
Yeah.
Yes.
Yeah. Which is an important distinction because we're talking about 14 billion annually.
Right. Okay. So 28 billion over the biennium.
Yep.
Yeah. What's in the RAND report is annual. What often gets reported out of state government offices is biennial. Okay. So sales tax, as we all know, Oregon does not have one. We are only one of 5 states that has no state or local sales tax, along with Alaska, Delaware, Montana, and New Hampshire. We can, a sales tax can be structured to exclude the essentials as they modeled in RAND in order to reduce the regressivity of it, although it is inherently a regressive tax. Sin taxes, a sort of a special category, I guess, of a consumption tax. So these are taxes on beer, wine, tobacco, marijuana. The figures that you see here are the estimated revenue from Office of Economic Analysis and OLCC as far as what they bring in per biennium currently. And then a luxury tax. This is a tax on a high-end item or items, boats, high-end vehicles, aircraft, etc. The US did have a luxury car tax. They actually had we had a broad luxury tax for a few years, from 1991 until 1993. We had a 10% luxury surcharge tax on, people buying aircraft over $250,000 and furs and jewelry over 10,000. It was all repealed except for the luxury car tax, which stayed until 2002. All told, across the US, that raised about 400 or 450 million a year. If we're thinking about a luxury tax in this, it's obviously difficult to project what that might look like in terms of revenue, but certainly it would be a very small amount of what might be needed. Cheryl, did you have a question or a comment?
Yes, I have 2 questions. One is in the sin taxes, which, as you know, are very important to the behavioral health system. Mm-hmm. And so in thinking that these would also be put into the big bucket, of all of the revenue, what will happen in the case of Measure 110, in which it's fairly, it was a ballot measure that was fairly prescriptive in how those funds would be allocated? I mean, would we be repealing, I don't know if that's the right word, the ballot measure if we were to go a single payer? So that's my first question. The second question is, would a millionaire's tax fit under the luxury tax, or where would that be? And because I've certainly talked with people and know people who would love to work on a millionaire's tax like in California, because they have way more funding for behavioral health. So my 2 questions.
Yeah, thanks. Oh, do you want to check?
Yeah, so as far as all of the sin taxes have statutory dedications. And so if we were going to move the ones that are going to health related, that's under our universal health care, into a pot, all those dedications would have to get changed, including the most recent one that the voters did. We'd be difficult. I'm not sure which ones might be in the Constitution, but I think they're all statutory. And then as far as a millionaire's tax, that would be an income tax change. It would be, you could have one sort of income tax change to bring in or to recognize we're paying for healthcare and want to pay for more. And then and part of it could be a new top rate on millionaires.
Thanks, Chuck. All right, Laurel, next slide, please. So just a little more on the sin taxes here. In Oregon, we, as it showed earlier, the current beer tax brings in about 40 million a biennium. It has not been raised in a long time. There is a proposal to increase it, but that is for, dedicated towards mental health, drug and alcohol treatment. And that increase would bring in 29 million for the biennium, which is I'm not suggesting that we would be reallocating that money to this, but just for some scope, that is a very tiny amount of what might be needed here. For cannabis, there's a projection that will bring in 320 million by the end of this biennium. It certainly is growing, but again, it's already allocated, that the destination where that revenue goes has already been decided. And then on tobacco, we do have a new tax increase on tobacco and a new tax on e-cigarette and vaping products that went into effect this past January. The estimated revenue on that is 330 million, so close to the cannabis per biennium. And our tobacco tax is fairly high. The map just shows the beer tax, and as of last year, Oregon was pretty low, 45th highest in the nation. Okay, we can go on. So I broke out the different sales and consumption taxes here separately. On the sales tax, the strengths are it does avoid ERISA challenge. It's very easy to understand. It's as permanent as anything can be, stable, predictable, scalable, can be dedicated, and it potentially brings in a pretty significant portion of the new revenue that would be needed to fund this plan. Just going back, the RAND estimate with an 8.5% sales tax would have brought in about 60% of the revenue that we're estimating would be needed for this-ish. So those are the strengths. The challenges, while there are some ways to make it less regressive, it is still inherent, it is regressive. It is a regressive financing mechanism. Politically, I know that this is not a value that this tag has identified clearly, but it has come up in the conversation that this type of revenue source may face significant political challenges. Oregonians have not been friendly to sales tax measures that have been brought up in the past. For the sin taxes, sorry, we have duplicate bullet points here, but it again avoids ERISA challenge, easy to understand. Gosh, sorry, I really went crazy with the ERISA and easy to understand here.
It's so easy to understand.
Definitely will not run us into ERISA. But it's regressive, and to me, I think the biggest thing is it's really not adequate, and is all of the current sin taxes that we have are dedicated to other programs and activities. Luxury tax, it is inherently progressive, and that is designed for folks who are higher income, also easy to understand, similar things that what we've already said, will not run into ERISA. It's also very inadequate, and doesn't do anything as far as federal dollars, and what constitutes a luxury item is somewhat subjective. Okay, next revenue method is the corporate tax. So as of right now, Oregon has a gross receipts, corporate income, and a corporate excise tax. So just so we're all on the same page here. So gross receipts tax, that is a tax that's applied to a firm's total sales. There's no accounting or deducting the cost. The corporate income tax is applied to the sales after costs are deducted. And then the excise tax is just a tax for the privilege of doing business here. We did have a relatively recent increase to the corporate tax in 2019 in order to fund the Student Success Act. So here you can see sort of where Oregon falls. We have a top tax, corporate income tax rate of 7.6%, which is probably in the top third maybe of states, top 40%. Strengths of the corporate tax, it is more progressive. So, you know, the rate can increase as the income increases or the revenue increases. It can be applied to larger corporations and exclude those under a certain size or a certain revenue amount. Permanent, scalable, and it can be dedicated to a single payer plan. The challenges are that this can be a tax that is more susceptible to ERISA. We did recently pass the corporate activity tax, as I mentioned, and that was a pretty big, a significant accomplishment or significant event. And so potentially it might be more challenging to try and do something like that again. It's also not very easy to understand. And then the last revenue method that I'm going to talk about briefly is the provider tax. So provider taxes are levied on healthcare providers or other healthcare entities. The revenue that's raised from these can be used to draw down federal match, and is used to draw down federal match for Medicaid, to support the Medicaid program. Pretty much everybody has a provider tax. There are a lot of regulations around what limits on how much providers can be taxed and what the shape of that tax has to look like. So a provider tax cannot be used to fund more than a quarter of the state share of Medicaid. It has to be applied evenly and uniformly. So everybody in a particular class of providers has to be taxed at the same rate. And the state is not allowed to, quote, hold providers harmless. So the idea that they're going to somehow recoup that tax in some other way. In 2020, Oregon provider taxes raised $1.8 billion. The hospital tax ranging from 4 to 6%, depending on whether it was a rural hospital or a DRG hospital. The tax that we have on insurers currently funds Medicaid and commercial reinsurance pool. And then we also have a long-term care facility tax that goes towards Medicaid nursing facility rates. Strengths of the provider tax: it is progressive, it can be dedicated, it's easy to understand, and I think also it's very close to, it makes sense that a provider tax is being used to fund healthcare related activities as opposed to maybe a tax on jets or something. It doesn't trigger any ERISA concerns. It is something that can be used to maximize federal dollars, bring additional federal match. Provider taxes generally sunset, and so you have to revisit them and renegotiate them every several years, which of course opens you up for the possibility that it may not be renewed, or it may be renewed at a different level. It is not scalable due to the limits that the Fed set on like I already talked about, you know, as far as the amount that can go towards Medicaid. There's a limit on, they can't be taxed more than 6%. And, you know, it's also not a very adequate revenue source on its own. I mean, most of the revenue sources here or methods we're looking are not adequate on their own or as a primary source. So it is a smaller subset of revenue methods that we're looking at.
And Sarah, we're already probably almost at the cap of it, right?
Yes.
Yes. Yes.
So that
Yeah.
kind of eliminates doing anything with it.
Good point. And I believe that is the end of our revenue method overview.
I feel like I want to ask for a round of applause for Nipper for getting through all of those slides. Wow, so what a thank you so much for
yeah,
humoring me on that one. So I want us to pivot now to really some discussion. What Nipper just did was she was talking about methods, right? And what we want to do is pull together some packages. So on this slide, what we attempted to do is give you some examples of what a package could be. And we used RAND as an example because it felt, you know, like an easy place to start to give an idea of what a package could be, and to try to give you a sense of some of the feedback that we're looking for from you all. So looking at this first example, which is how RAND proposed funding a single payer system, they started by saying, okay, we want to come up with an employer payroll tax whereby in the aggregate, employers are paying roughly the same as what they are currently paying for benefits. And we want one that impacts a very small slice of employers. And based on those two kind of criteria, they came up with this new 6.5% employer payroll tax applying to firms with 20 or more workers. Then they said, okay, how much more money do we need? And they used that determination to come up with a proposed increase to the personal income tax. So those are the types of considerations that we're really trying to that we're looking to you all for. This other approach that they took, this sales tax, I wanted to include it here just to highlight that there are some instances where a revenue package might be just a single method. And in this case, they were looking, again, this was for a different proposal, but they mapped out what a possible sales tax might be. And the sort of principles that were guiding this is they wanted to create something that would be, they wanted to make this sales tax less regressive by exempting essential services. And like that personal income tax calculation, they chose the rate based on the adequacy of the funding. So they really just said, how much money do we need? We'll set the sales tax in this analysis at that rate. So these were some examples that we wanted to offer you all, and we wanted to have sort of these revenue methods on the right that Nipper just walked through, so that you could see in some ways your menu of options, so to speak, when thinking this through. And I'd like to turn it over to you all now to hear your thoughts on what revenue packages you would like to see analyzed.
Laurel, if I may comment first, thank you, Nipper and Laurel, for presenting complex material in an understandable and very useful fashion. Much appreciated. And Nora, thank you for helping us to understand the RAND report. I am going to enter the fantasy world of single payer again, in which we will need to collect the maximal amount of dollars compared to any of the other plans we want to provide. I suggest that instead of aiming for $14 billion, we increase that by 20%. $17 billion. Why would we collect more money than we need? Well, first, we will need a reserve fund. SAFE has a reserve fund that is 4 times their annual budget. We do not want to underfund this by $1. So anything that is excessive, we put into a reserve fund. Second, if we have a tax plan that includes 3 of these major tax funds and we're 20% over, we don't have to sweat the multitude of smaller taxes that we're collecting. We can be independent of these small bites of sin taxes, et cetera. We can let the rest of the state fight over that. Also, the RAND estimate, as you heard, reduced provider payments by 10%. Now that doesn't reduce total cost by 10%, probably a small fraction of that. But if we would like provider buy-in to this, we should be able to pay them not 90% of what they get now, but close to 100. Lastly, or maybe not lastly, we would like to create in our fantasy single payer world, no cost sharing. So we're not sure how much that adds to our cost, not much, but we want to cover it. And finally, we would like to get benefits that are among the best in the state. So if we attempt to collect 20% more than the RAND estimate, which is a pretty solid estimate, by the way, then we do not have to worry about financial catastrophe or the next epidemic, or having the state nibble away at all of the other state funding that we require. I have more
Thank
to
you, Dr. Metz.
wait.
Thank you. One thing I want to offer is we can absolutely, when we come up with these various packages, kind of offer how much the rate would be if it was 14 billion, how much it would be if it was 17 billion, how much it would be for 20 billion. And so when we do that analysis, we can absolutely take that route. So thank you for that guidance.
Thank you for explaining that.
So-
well, that would be
Yeah.
valuable.
Yeah, but I want to make sure
So-
that we're able to then pivot though to landing on some packages. Yeah.
So I agree with Sam that anything we do, we should try to be conservative in our estimates so we don't end up $1 short, and whatnot, and how we sort of build a rainy day fund, for extra money for those rainy days is sort of a separate issue, but besides being conservative. So I would propose, I really didn't, I'm sort of thinking of this and looking forward to sort of getting a number of what's the target for less than the ideal, because of the problem of, I think the la-la land, I think it's sort of la-la land for universal, because we're not going to get a Medicare waiver, we're not going to get an ERISA waiver and all that. So I'm not sure what the total dollar amount is, but as Laurel just said, we can come up with a plan and then play with different rates to get to the dollar amount. So I would have a big chunk of money come from a broad employer tax. Broad, so the rate is lower. I would consider doing it where it's only on income above, only on employer payroll for an individual above the FICA limit. But I'd also include it, and that's why it's not really a payroll tax. I would call it our universal healthcare tax. Start John's rebranding and say that it is on all income, because there's a lot of wealthy people who get their income not from their paycheck, but from other ways every year. And we can capture that. So in a broad tax based on payroll above for all employers, so the rate's lower, and I would start it with payroll above the FICA limit. So this, and then maybe even consider a higher limit sort of a millionaire's tax on that, right? So if, from 140,000 to 250,000 is one rate. And if you're paying someone more than 250,000 a year, you pay a higher rate. And then you also do it on that other income. So you maximize it that way. And so I would do that. And then if we were going to have a general broad sales tax, besides, the exemptions of essentials doesn't really affect regressivity very much. It's very important to do, don't get me wrong. But the way to deal with regressivity is, which has been done in the past from all the way back to 1993 when we did measure 1, or 92 or 93 when we did measure 1, is you put in a sales tax credit and on the income tax for low to middle income up to people, and that takes away the regressivity, the ultimate regressivity of that tax. And so that's what I would consider, and make sure it's essentials, and excluding the essentials with a sales tax credit on your income tax, and make sure it's covering all services. We should, everybody, the Legislative Revenue Office often points to Washington. I'm not sure theirs is the most ideal at covering all services. So, but it would cover all services. That's
including essentials.
No,
Okay.
not essentials. Right. So,
all
right. So, right. And so what's essentials? I mean, I will tell you that there'll be, lawyers will come in and say, hey, my divorce bill for getting you a divorce is essential. Right. So you can't charge that. I can't charge on that service. So really being real clear that we're talking about not on, so I would say you're not taxing sales of rent, but you would tax if someone came to on the service of fixing your rental unit, right? Would get paid. I mean, so all services get charged, with very few. I mean, essentials has to be really limited to purchasing of items, not services, drugs, and things like that.
And Chuck, I'd like to clarify. Oh, go ahead.
I mean, and I'm not, so that's what I would do. Services being very limited to healthcare and food, essentially, maybe utilities. But the utilities, we're charging the corporate activity tax, and that one, PGE at least, is trying to pass on to people, in their bills directly. So.
In this brainstorm here, I'd like to confirm that you see these as two separate packages for analysis.
Well, I think both of them together as sort of the main two sources of trying to get as much money as we can, maybe all of it. Yeah.
So one package that includes a payroll tax and a sales tax.
And a sales tax and the very broad payroll on all employers.
Yep. Okay. Got it.
Like unemployment insurance, right?
This is Chad. Chuck, I think you're on the right track here. I may be off. This may not be the right timing for this, but I continue to sort of worry about what the right big number is. And I took note of Sam's kind of gross up approach. I think the provider thing is an issue. But I also am a little bit concerned about the benefits package, and that if this benefit package is the benefit package that we have historically had, then we need to think about the target that is above that, if it's our intent to have benefits that exceed the current benefit package.
Yeah, I mean, what our dollar number is I think really hard to get a handle on any.
I
at this
agree.
juncture.
I just wanted to make that comment that if we get sort of ourselves focused on a particular number, I just want to make sure that we're, that we're not backing ourselves into a corner when we really want benefits that exceeded, or we want provider payments exceeded, or we want a reserve fund or whatever else it is. And I just want us to keep that in mind.
And I guess I'd also add the Hippocratic oath, do no harm to any existing tax. So any of the current sin taxes and all that, we're not getting rid of those or messing up those sources.
Chuck, I think I agree with you. And I think we should have variant 1, which is fantasy single payer that needs to maximize revenue. And then reality 2, which is less than single payer. For reality 1, I like Chuck's bubbler approach to the employer, BBLR, broad-based low rate. And I think that should be approximately what the RAND study proposed. And if I understand that, it's somewhere around a 6% sales tax, plus an increase in income tax, again, similar to what the RAND proposed, which would collect 50% more than what we're collecting now in some progressive personal tax on all income, not just wages or salary. And lastly, just to step on one of the biggest landmines, I'm going to support Chuck's proposal of a broad-based sales tax that excludes however we want to define essentials. That would be probably in the neighborhood of 5%. What I would like to do is have this will help Laurel the calculation, have half of the revenue of whatever our target revenue is come from progressive income tax, a quarter from a broad-based sales tax, and the remaining quarter from the broad-based low rate, as progressive as we need to make it, payroll tax or employer tax. That would be variant 1. Maximizes income so that when the single payer ferry waves her wand and we get our ability to get the super waiver from the government, we get all these waivers, we're ready to go. I think that for the next variant, what I think Chuck is talking about, which is something more real, we'll need less money, and the first tax we would get rid of, would be the sales tax.
Okay.
I know Cheryl had her hand up, and I see Glendora has her hand up. I just want to make sure I have the queue of who else is trying to speak.
Thanks.
Anyone else? Okay, Cheryl, let's start with you, and then Glendora, we'll kick it over to you. No, Cheryl, Glendora, it's your floor.
Okay, thank you.
Cheryl,
Well, I have a suggestion whereby we contemplate changing the structure of our tax revenue, and that is if we can think about the pros and cons of employers having to provide health insurance on their employees by establishing a contract with the single payer, which is the state. So I'm thinking that would eliminate it would be a benefit to the healthcare consumers if they have to, if the insurance costs were equivalent to what the private market set, as far as reimbursement to the providers. Now, I don't know if that makes any sense. Usually nobody understands what the hell I'm trying to say, but at any rate, that's what I'm thinking. Trying to establish some equity here and equality in how low-income employees are, our health insurance is sponsored in a manner other than through the current employer-sponsored manner. So I'll just stop right there. Chuck, what you think?
Linda, can I just clarify something? Ask a clarifying question.
Yeah.
On this idea, though, this would be employers would not be providing insurance anymore, right? You're just trying to basically make sure that the money that they would be paying towards health insurance is now being contributed to the cost of the single payer plan.
Well, that could be the same thing, but I don't understand it to be. What I'm suggesting is that the employer sponsor healthcare coverage through the state rather than through private insurance market for their employees.
Oh. So you're okay.
I think this is the TPA idea.
The public option.
Yeah. And so I appreciate that. I think what I'm hearing you say is proposing.
It would eliminate the private market from being the source of acquiring health insurance.
Right. I hear you. I want to say that I do think that that proposal is a bit in contrast to some values that we've heard come out of some of the other groups that have said that they want to be untying employers and healthcare. That doesn't mean that it's not worth putting on the table for discussion. Do you have because we're talking about revenue packages right now, do you have a way to be funding this, or are you simply kind of proposing that employers be paying for healthcare by buying a state-funded package?
Well, I see it as generating revenue to pay for the healthcare system if the employers would contract with the state to provide healthcare coverage for their employees rather than contracting with private insurance, market.
Okay. So, but this isn't a tax. So you're proposing a revenue method that's not a tax.
I'm proposing a way to generate revenue.
Good.
Wouldn't that enable the state to have access to funds that could pay for the healthcare system, or not?
Maybe tell me if this is what you're saying. It sounds like you're saying we're not trying to do an employer mandate, but in our scheme, like we're talking about a public option in Oregon, you would basically have a public option for business, for employers. And so they'd be paying these taxes, and employer X can say, God, I'm buying through Providence. I could buy the state plan for my employees. I still want to be the one providing it for whatever reason. I want to be seen as that benevolent employer. I want to have that expense on my books that I can deduct on taxes. So I'm going to buy a plan for all of my employers, but I'm going to buy it from this new state universal health fund.
Yeah, but I don't want it to be reduced to a state sponsored healthcare coverage plan and still have the recipients compete with the private market insurance, because that will have some of the same outcomes that we are currently experiencing in providing healthcare coverage for the low-income population. or,
Yeah.
Right, but if the,
It sounds like it's an option, but not an option. In other words, really, it's a mandate to continue to buy, but to buy from the state.
yes, because that's how we are going to, I think it could have a great positive impact on affordability and
Yeah.
equality as far as healthcare services, how they're delivered, and you know, so I'll stop there. So I
Absolutely.
don't know,
So
Chuck,
I've
if that's
captured that.
public option or not a public option, just an idea.
I mean, it's a real thinking out of the box idea, Glendora. So
Yeah.
I've captured that here as an employer purchased option, to just have it on this list here. I wanna try to circle back. Oh, John, yes, please.
Yeah, just a couple of comments. I favor, status quo when it comes to the provider taxes, except I think it's obvious that the health insurers would not be interested in paying a tax since they're out of business. So that health insurance provider tax has to be figured into what we need to find an alternative to fund. Okay, that's number one. I'm not in favor of adding any sin taxes because they're just very difficult in Oregon. People want their beer and don't want to pay taxes on it. I think for whatever reason, those can be emotionally unpopular. Likewise, some of the ways I saw luxury tax, I don't think are doable. I personally would try to avoid a sales tax. So I think looking at options that don't have a sales tax to just see, how big you have to go to get those. I do want to, genuinely argue that I think it's legitimate to increase the Medicare payroll tax in order to fund what will be very substantial increases for people 65 and over in Oregon. And I think that could be justified. And, when you think about it, I mean, you would like younger folks paying taxes that they will benefit from when they get to be older. So, I'm really interested in seeing what the impact of expanding the Medicare payroll tax would be in various ways. I'm interested in seeing seeing different employer scenarios. I really do think that many of the most genuine and caring employers who have tried in various ways to do a good job of healthcare are almost done with it. They are so frustrated with consolidation in the marketplace, outrageous pricing. They are at their wits' end. And I think the right proposal in which employers were either given a transition out or were, given a situation where they, would contribute, but not at the level that they're contributing now, they would support. And I think that could make a huge difference in a variety of ways. So I think those are the options. The other one is, I think there needs to be a more serious means tested tax than income tax. I will get myself in trouble and say that perhaps there should be a tax on retirement plans when one gets to the level of the required mandatory distribution. Do you all know what that is? You know, when you're 71, 70, it's now 72, you are required to withdraw and, you know, around 5% of your retirement plan and pay taxes on it. Okay. Obviously, you know, the folks who have substantial amounts of money in retirement plans are the wealthier folks. You know, I just wonder if that would be a way to identify a wealthier subset of folks who have made it to an older age. You know, realize one of the challenges here, who doesn't pay the Medicare payroll tax? People on Medicare. You know, they don't pay that tax any longer, which is, I think, just fine for low and middle income people on Medicare. That would be appropriate. But, you know, those of us who have done well and have the resources should contribute, even in our older age. So I would think about something like that.
Just want to give us a little bit of a time check here, just because it's 2:45.
Yeah.
And this is a great discussion. I just want to see, is there anybody on the call who would like to provide testimony today, just so we have an idea?
Okay.
All right, well, that maybe gives us a few extra minutes here. But
John, well, Chuck, do you want to go ahead? I was going to ask about if I captured it correctly.
Yeah, ask him if he captured yours, because mine wasn't captured, and I actually just sent you an email about how I would like it, the first sub bullet on mine.
Okay. John, I tried to kind of capture the various things you were saying. I'd like to be able to turn it into a package that we could analyze. I kind of offered this increase in the Medicare payroll tax, and then I was wondering if you were thinking that could be supplemented with an income tax, but then I heard you say that you wanted something that was more means tested than an income tax, and so I worried that may not capture your vision.
Then I would probably want to see how far you could get with an increased Medicare payroll tax, a progressive income tax, and then a wealth tax of some sort that might look at those of us who have reached retirement age and are wealthy. I was impressed yesterday. I was looking at Medicare because I've become obsessed with Medicare and the impact it could have on what we're doing. And first of all, Part A is in trouble. It really is. It's going to go bankrupt by 2026. So almost certainly Biden is going to have to do something to stabilize Medicare Part A. But one of the things that was interesting was when you get to Social Security, which I realize we're talking about health, not Social Security, and this is never going to happen. One of the scenarios that the Social Security trustees are looking at is to no longer put a cap on Social Security taxes. So, right now, when you get to $132,000, you stop having to pay Social Security taxes. If you took that cap off, in other words, Social Security taxes continued at 7.5%, all the way up to the millionaires, you generate an enormous amount of money to stabilize Medicare, just enormous. And you know, we all know that the income inequality thing is really out there, and how best to tap into that. What's the fairest way to tap into that?
I'd like to just put a little parking lot issue there. It's really not for now, but I think something that John referred to, which is really important, and that is predictability about future increases. I think a lot of employers would be happy if they could just have some comfort regarding predictability of future increases. And I think we should sort of think about that downstream.
I love that, Chad. And I think it's something that we can add even to the, I was going to say scalability, and I don't think that's quite right, but I could see us being able to capture that in a principle.
It's just a big sale item, I think.
Yeah. So looking at these packages, is there any interest in looking at an employer, just a simple employer payroll and personal income?
Yeah.
Yes.
Yes. Okay.
Once, twice.
Yes. It's sold.
This is Bartleman. Can I jump in?
Please.
I was hoping that a couple of the tag members could elaborate on what some of the different employer purchased options might be and what you mean by options there. Is that essentially saying like different potential thresholds for like size of the employer or something else?
Well, I heard Chuck say everybody, I think.
Yeah, what I was thinking is we can't sort of, I was operating under, we're not going to have an employer mandate because of ERISA. But we're going to have incentives and disincentives to try to get them to not be providing coverage because of the general
sorry.
consensus
I totally am looking at the wrong bullet. I didn't mean the employer purchased option from Glenn's comments. I mean, there was a bullet that got deleted that was about just an employer payroll option that I think I heard John.
I think it was John. Yeah.
Yeah. Sorry.
But, yeah. Well, that's, and mine's an employer payroll option too. I mean, that's the first one for me. I would do it on all employers, and I'm certainly open to bifurcating and calling some of it the state Medicare tax.
Is there interest in only looking at an employer payroll tax and seeing how that would have to be scaled to meet the target?
You know, I think on all of these, I think we'll get that once we get Chris Allenak folks to run the numbers. But for me, it would be on all employers. I'd like to see it be and other income. So my amendment, I don't know if Laurel has the access to her email.
I don't. I can't check my email while I'm sharing.
Okay.
Yes.
So I would have it be on, above the FICA limit. It's not then a higher rate on the highest income people, like a millionaire's tax. So let's say, at 500,000 up, and be on other income. So for the executive and all that other income that are on wealthy people's income tax return. And so it would be a really low rate. But if I was getting taxed, if I was getting taxed, I'd be a high income person to begin with, earning over 130,000, whatever it is. And then if I had this other income, it would be on that as well. And
yeah, I'd just like to say that would meet some of my concerns too.
Right. And so that's what I would like. And then, what we can play with is the tax on that other income and on your wage income or salary income. Is that, a flat rate from 130,000 up, or is it at 500,000 or 250,000? You sort of increase the rates, make it a progressive, even more progressive. So that's how I would do it. And I don't know how, right off exactly how much that could raise and at different rate levels. And then on this, so that's how I would do it.
Bartleman, were you asking If we could fund a non-single payer option that is skirting around all the federal programs, how much a payroll tax, employer tax would need to be if we used it exclusively as the only single tax for.
There was an earlier bullet in the draft reactions to, I think, John's comments that was employer tax options. And I wanted to be clear that I just wanted to clarify whether or not you were advocating for exploring, Sam, exactly what you were describing, or if it was only these employer tax options in combination with sales and income tax.
If it's not too much trouble, and everything is too much trouble, I'm sure, it would be interesting to find out what type of employer tax we would need if we were going to fund it exclusively with an employer tax. My guess is when our work is done, we will be asked why we didn't consider that option, and we can give them an answer. And the answer will be, we could fund this exclusively with an employer tax if it were 20%. That's ridiculously high, so that's why we didn't consider it. So I do have a small amount of interest in that figure.
Thank you. I think
I'm going to say I do too. I think it's, if I didn't have to add a sales tax to mine, I sort of assumed we would need a sales tax because it would be too high a number. But so my priority is the employer split 50-50 employer-employee payroll tax on income over that, and on all other incomes. I have a hard time calling, I just want to call it a payroll or earnings tax. And then, but I'm open to having a small broad sales tax as well, but may not be needed.
Can I poke at that question, that piece about 50-50? So here I've been typing out employer payroll tax. Are you considering, am I incorrect in framing it that way? Are you all talking about a payroll tax that is half an employer payroll tax, half an employee and payroll tax?
I am.
So let me just say, how much they raise is based on the total percentage. So whether we decide that it's split 50-50 or 20-80 or whatever I know the family medical leave has a split. I can't remember what it is. I will tell you that when Chris Allenak gets asked, well, who's ultimately paying this? He's going to say the employees are. Out of there, it comes out,
Right.
And the folks at the Institute on Taxation and Economic Policy will say, this is who pays it. And they're not going to say it's the employer. They're going to put the two numbers together. And so I think we can have that discussion about whether there's a split later.
Right.
If an employer isn't paying, if an employer has taxable income and isn't paying health insurance and isn't paying a payroll tax, if it was all on the employee, they're going to pay more in taxes because that's a deductible expense for them. So, I just think we can have that. How you split it is a political decision of how you try to sell it, right? And calling it a payroll tax that the employee pays full time, or all of or most of, probably helps get around ERISA. It's not a met right. And so I think people should be open to whether there's a split, knowing that once it goes to the voters and the legislature to approve, people are going to say, well, who's paying this? They're going to say it's a tax on employees. Yeah, it is. But my health insurance has been a tax on me too. I've gotten health insurance from my employer and they pay me less.
So I'm aware that we have 3 minutes left and we have 5 packages and 1 alternative revenue source on the table. I'd like to keep this alternative revenue source. We can kind of put that to the side, and we can discuss it either within the context of revenue or in other conversations that the task force has. Looking at these 5 tax packages, I'd love some guidance from you all on how we can hone this list into 3 to 4 packages for consideration.
I think what we do is, I think we have 3 or 4 sort of main taxes that we need legislative revenue folks to run numbers on, and how they get combined either in my bullet or the second bullet doesn't matter, right? So we have them run payroll tax numbers. We have them run a broad sales tax. John's Medicare payroll tax is a payroll tax just on I don't know what to do on the wealth tax. That's a hard one for me to tell them what to do, but it seems like they could come up with a few variations of a payroll tax, a few variations of progressive income tax, a millionaire's tax, or half a millionaire's tax, or whatever.
Okay.
Are they targeting it to 17 billion? Is that the peg right now?
Well, I think what they do is they don't need the target. They can sort of have that in mind when they're trying to say, well, should it be a 1% or 8%, and to be close, but we really just need to get numbers of how much they raise, sort of like in that chart in basic facts, a percentage on our, right. Okay. And you'll get a growth. If you had a 5% sales tax, it would bring in this much. If you add every percent you add, will be about so much, right? Okay. And then we can play with it.
Got it. Thank you.
Laurel, out of all of these that we're looking at, the last one that I said I had a small interest in, we should discard that because it's the least practical of all of the considerations that we have right now. And if we get that number later or not at all, we'll still have a good range that we've created here. So unless anybody else objects, let's throw out that last one, the exclusive payroll tax.
And I think what Chuck is suggesting here, which is essentially we're going to be turning around and giving you all some building blocks that you can assemble in different ways and sort of see, you know, how they might fit together and what you think about that. I think that is a doable thing that we can, you know, size these essentially and bring them back.
Nipper, I have one more suggestion, which is I believe I included in my last email to this group a spreadsheet created by Warren George. Warren, you're on the call. Thank you for joining us. That does something of what you're doing about building blocks. It says, if we create a tax of this percentage, what's the revenue that will be generated based on the latest LRO figures? I think if we have something like that, we can take this home and we can, over a cup of coffee, we can start sticking in numbers and we can get a really good idea about whether our favorite idea is preposterous or not. And that might help you help us.
Yeah, I think the idea is real consistent with what we're thinking about here. So we can run with that for sure.
Thank you.
Yeah, I mean, I think people should certainly feel free to play with Warren's thing. I just think like my proposal and some of the other ones I don't think are included there. And I just wanted to get clarity on John. John, you said the way I explained that tax on that other income sort of got at your wealth one. Is that what you were? Yeah. Versus a wealth taxes are typically like how much property, real estate do you own? No, okay. Yeah, so you were using it that way.
When you were making your comments about other income.
Yeah.
Something that brings in other income.
Right.
And there's no
of the well-to-do, right?
Yeah.
That's a helpful clarification. Thank you. Okay. I feel like we definitely got the guidance that we needed to be offering these analyses. We will be doing some of it. We'll be pulling LRO in to be doing some of it. And our goal, this is why we pushed back our upcoming meeting, because a week and a half was not enough time to develop the type of work product that we wanted to be delivering to you all. So our next meeting is now on the 17th of March. And our goal will be to be walking through a proposal that you'll have in advance for discussion.
Yep.
Several proposals, several analyses of everything that we've gotten here today.
Thank you, Nipper, Bartleman, and Laurel, for superb work. This was one of the most productive meetings ever. I appreciate it.
And you know, I'd just like to say, I think Glenn's idea, when we start to talk about how can we work with businesses on this, we need to go back to that, because it'll be interesting to hear from business and do some brainstorming with them. And I think the idea she was describing might appeal to businesses.
And there's also this pathways group that's coming up. I think there's going to be a lot of opportunities for discussing various ways to be integrating unique ideas and out of the box thinking into all moving in the same direction of increasing coverage.
Yeah, I mean, I think some employers, given I think what somebody said, give me something totally predictable that, you know, I can just contribute to and know that some competitor isn't getting a much better deal than me, you know, and I really just don't need to do anything because I'm tired of doing that. Might be willing to continue and hang in there.
Well, thank you all. Chuck, do you have any final words, Nipper?
Well, I was just wondering, do anybody have any burning questions for the Consumer Advisory Committee? I don't want to give that short shrift. Glendora's here, she'll see us give it short shrift.
That's right, Chuck.
Does anybody? I know you're watching.
You know, I should say we had to cancel our CAC meeting because of weather issues. So the question you generated last time is still in the queue. So okay. We've got something to bring up with them around taxes, and we'll give them your phone number if they want to complain.
Okay. And we don't have anybody to give testimony, so I guess we're done. Thank you, everybody.
Thanks.
Thanks, everyone.
Thanks.
On the 17th, I'm Charlie Oshekatoff.
Yeah.
Are you gonna have a hat and a
but I'll share my story with the staff, and you guys can decide whether it's worth sharing with the rest of the group. So, how I got that name. So,
Margie, you can stop recording.
Take care.
Thank you.
Thank you.
Margie, can you stop recording?